Japan has declared a state of emergency for Tokyo and 3 neighbouring prefectures. Prime Minister Yoshihide Suga says that the country is in crisis as COVID-19 cases multiply there. Now, infections in Tokyo climbed to nearly 2,500 today, hitting another record high. Mr. Suga has pledged to improve the situation within a month. Michio Ishida with this report.
Prime Minister Yoshihide Suga finally called for a state of emergency for 4 prefectures after daily cases started to show a steep spike the end of December. He declared what actions he wants restricted. The key is to prevent people from eating and drinking out, which experts say are the main cause of the coronavirus spreading. It's especially the young people in their 20s and 30s who, without showing any symptoms, are spreading COVID-19 at home. And they're seen as the cause of infecting the elderly, who are the most vulnerable. But this means restaurants and bars will be hurt. So Mr. Suga pledged to provide subsidy to those that comply up to 1.8 million yen, or about $17,460 a month. And if business operators do not comply, he cannot force them to close by 8 p.m. as there's no law to justify that. So he wants to legislate a special law to take punitive action against those who do not. Now, regarding his subsidized travel campaign, which has been suspended in December, he said the campaign will not be resumed during the state of emergency. Mr. Suga doesn't want to shut down all activities like his predecessor Shinzo Abe did for the last state of emergency in April to May. Schools, nurseries, and kindergartens are not requested to close. Universities are asked to combine online and face-to-face classes. Burden on healthcare is one major reason to call for a state of emergency. Mr. Suga will subsidize hospitals for increased beds to treat COVID-19 patients, along with his pledge last month to provide subsidy to nurses and doctors treating those patients. It's as medical workers having been working around the clock with lack of manpower. Now he wants to bring down the alert level from stage 4 to stage 3 in a month. But experts say this is not going to be easy to achieve. Michio Ishida, CNA, Tokyo.